Have you ever wondered why your orthodontist said you may need to get teeth pulled before starting with braces? I get this question all the time, especially about premolar extractions. My name is Dr. Eli and I'm a first-year orthodontics resident. I bet you've been doing all this research about why orthodontists recommend extractions before starting braces. Well, you've come to the right video because in this video, I'm going to talk about all the reasons why you may need extractions before starting braces and what effects it might have. So premolars, also known as your bicuspids, are the four teeth located in between your canine and your molars and your maxilla and your mandible, also known as your upper and lower jaw bones. They serve the purpose of crushing and grinding food. There are a few reasons why your dentist may recommend premolar extractions before starting braces, and that's usually to resolve crowding, fix protrusion, or correct your bite. Now, I'm sure as you've been doing your research, you've come across different things about premolar extractions, such as how it may change your face or affect your airway and things like that. And later in the video, I'll make sure to cover all of those things. But let's start with talking about each reason why you may have to have premolars extracted and the results that come from it when having orthodontic treatment. So reason number one why you may have to have your premolars extracted is for crowding. The reason is actually very simple when you break it down. If you have crowding in your dentition, there's pretty much one cause. Too many teeth, not enough space. So what do you have to do to resolve that problem? Is take out teeth. You see, your mouth is a restricted area, so we can only move teeth within the realms of the bone. So if your teeth are severely crowded and it's not something that we can just resolve with expansion, we may have to take out teeth in order to get the right arch form. Now, I know there's a lot of things that people think about fixing crowding, whether to take out teeth or not, and honestly, it's very complex. But I'll try to break it down in the most simple terms that I can so that you can understand better why your orthodontist is recommending that you have teeth taken out for braces. So think about it in your head. In your lower jaw, you have a bone that your teeth sit in, and then in the middle, you have your tongue. In your upper jaw, you just have one bone, and in the middle of your teeth, you have your palate. When doing orthodontic treatment, we always follow what's occurring in the lower jaw. Because yes, technically in the upper jaw, if you have crowding, you may be able to resolve that by expanding the arch using an expander. Because up into a certain age, when your mid-palatal suture fuses, you can expand the upper arch to resolve some of this crowding. And even after the mid-palatal suture has fused, you can do a surgical expansion or even expansion with the assistance of mini screws that are screwed into the bone to help with expansion. But the issue here is you cannot expand the lower arch with an expander. In the middle, you have tissue. You have your tongue, you have the floor of your mouth. You cannot use an expander here like you can on the upper. Sometimes in the lower arch, you can get expansion just using the wire from braces. However, when you're doing expansion in your arch, you have to pay attention to how proclined or protruded the teeth are in the lower arch. If the teeth are already very proclined, you cannot get enough space to actually do more expansion. So then you have to take teeth out. So the simple reason why you may have to get teeth out if your teeth are crowded is because there's too many teeth and there's not enough room for all of them. Now, the second reason why your orthodontist may recommend extractions when having orthodontic treatment is from severe protrusion of your teeth or your lips. So think about it. When you look in your mouth or when you see pictures of the inside of your mouth, your teeth may not be crowded, but your front teeth and your lower teeth might stick out a lot. Imagine if your front teeth were flared out like this and your lower teeth were flared out like this. When you have braces and they bring the teeth back, then you'll have another issue where your teeth won't fit. So in order to prevent that problem, your orthodontist may recommend extractions. And I know that's confusing for a lot of people because you may have already heard that you only have to get extractions if you have crowding, but you never realize that your teeth stick out so far, and when we bring them back, then you'll have that issue. The body adapts so that you have homeostasis within every region of your body. So sometimes your teeth may naturally procline as you grow older in order to prevent crowding from happening. But then when you get to the point where you want orthodontic treatment, something has to be done about that because the teeth will come back just from the wire on the teeth and it'll result in an issue with space. Now, the last reason that you may have to have teeth extracted for orthodontic treatment is to correct your bite. If you have a class 2 occlusion, which means that your upper jaw sticks out further than your lower jaw essentially, or a class 3 occlusion, which means your lower jaw sticks out further than your upper jaw, you may have to have surgery to correct this truly, or you can have a camouflage treatment, which means we treat it through the teeth, but not necessarily the skull. So commonly, if you have a class 2 occlusion, meaning your upper jaw is sticking out further, you may have your upper first premolars and your lower second premolars extracted in order to correct your bite. This will leave you with the proper class 1 occlusion on your molars and your canines when you finish your orthodontic treatment. Similarly, if you have a class 3 occlusion where your lower jaw sticks out more than your upper jaw, you may have your upper second premolars and your lower first premolars extracted so that they can bring your teeth back and finish you with a nice class 1 occlusion. These teeth extractions do result in some facial changes, but they're not very drastic. Most of the time, it'll change your face for the better. It'll keep you from having a very rounded facial look or an inverted kind of moon face kind of look, and you'd actually be pretty happy with the final result. Now, not everyone needs teeth removed. Modern orthodontics has made changing people's dentition and moving teeth around very easy with different things like interproximal reduction, where we shave in between the teeth a little bit, expansion, archwide expansion, reshaping contacts, all kinds of things. So you'll notice when you go to the orthodontist, to be honest, 9 times out of 10, they don't want to take teeth out for treatment. They'll even start treatment by trying to get things right without taking teeth out, but they'll tell you, as we progress, we may see some things and we may decide to go down the route of extractions later on. Orthodontists or dentists too, we don't want to take out perfectly healthy teeth. However, in a case-by-case basis, sometimes it's just better for the patient. In mild to moderate crowding cases, we often keep all your teeth, and we still achieve an amazing result. So if your orthodontist says that you don't need teeth out, that's just as intentional of a decision as taking teeth out. Orthodontic treatment planning requires a very strategic thought process, and you have to think years ahead into the future to see what effect certain things you do at the beginning may have further down the line. So why are people so afraid of premolar extractions? Let's talk about some of the things that people have found online that make them kind of wary about getting teeth taken out. Now, of course, most people don't want to see healthy teeth go, and a lot of people just don't want to have teeth taken out. And that's super understandable. But I feel like when I talk to my patients, a lot of them are concerned about how taking teeth out will change their face. Also, pretty surprisingly, a lot of people ask me, so you guys are going to close the space, right? Of course we're going to close the space. That's what the braces are going to do. We won't take teeth out and then leave space in your mouth. We're going to do our best to close all the space. So do extractions change your face? Sometimes yes. Most of the time, if you have severe crowding and we perform extractions so that we can resolve the crowding, your face won't change at all. However, if we are taking teeth out to correct your bite, sometimes those can have minor changes to your face. However, the goal is always harmony, not flattening your face. In my few months of orthodontics residency, we've always talked about the effects of orthodontic treatment on your soft tissue, your skeleton, and your dentition. So we are considering all of these things when we treatment plan for orthodontics. And I'm telling you now, we're not doing things with the intention of flattening your face. In more recent developments, people have been talking about how premolar extractions when they were younger has contributed to them having airway problems as older patients, as older people, developing sleep apnea and things of the like. And honestly, there's not enough literature to support that. Imagine how many things change as you get older. Weight gain, lifestyle changes, diet changes. There's so many things that happen as you get older that contribute to sleep apnea. And I really just don't think that there's enough concrete evidence to say that premolar extractions are outweighing all of these other things. Extractions have been around for a very, very long time. They're nothing to be afraid of. This is a common practice in orthodontic treatment, even though you may not hear of it much, because that's simply a result of orthodontists being oral health professionals and doing our best not to have to remove teeth for treatment. So every extraction decision starts with the diagnostics. We take a careful look at your x-rays, your bite, your photos. We analyze your crowding, your airway, your facial profile before we make the decision of whether we're going to extract teeth or not for treatment. If everything lines up, that's how we come up with the decision to extract teeth for orthodontic treatment. but only if it all makes sense. So trust, extracting teeth for orthodontic treatment is never a random decision. It's a careful balance between form, function, and aesthetics. So what should you expect if you do have to get extractions for treatment? Your general dentist or your oral surgeon will do the extractions typically before starting orthodontic treatment. You'll be a little sore for a few days, but once the healing starts, we use those spaces very strategically during treatment. I mean, I've done over 30 treatment plans at this point, and when we're talking about extracting teeth, we're considering everything down to how much we want to move the front teeth back or the back teeth forward, how we want to use the space to correct your bite, your crowding, and everything like that. Over time, braces will move the teeth in the way that we want them to, following the treatment plan that we came up with before we even took the teeth out. And overall, it'll resolve your crowding, correct your bite, and improve your smile. By the end of treatment, most patients forget what teeth were even taken out. So to sum it up, premolar extractions are not something to be afraid of. It isn't about just pulling teeth for the sake of it. It's about creating harmony between your teeth, your face, and the relationship between both of those. If you're in treatment or you're planning to start soon, don't be afraid to ask your orthodontist why they need to take teeth out. Any competent orthodontist will be very happy to explain to you the reason and put you in more comfort so you know why they're doing the things they're doing and what result it's going to have on your teeth, your face, everything like that. I want to thank you all for watching, and if you found this video helpful, please make sure to like the video. This is how I know that you all want to hear more things about orthodontic treatment, and I'm trying to do my best to help explain things for patients to put you more at ease, especially because a lot of teenagers and young adults just don't understand what's going on when they go to the orthodontist's office. So please make sure you subscribe, like the video, leave a comment under the video if you have any more questions, because some people may have the same question as you, and we can have a healthy discussion in the comment section of this video. I'm glad to explain anything that you may need, and I hope that you found this video helpful. That's all for today. Thank you all for watching. Again, make sure you subscribe. You can also go to the rest of my channel and watch some other videos with advice from an orthodontist in this playlist that I'll link at the end. Thanks y'all for watching.
I got baguettes in the back of my ring, and I went me trying to hit. I told her she gotta run to the team before she can talk to the lit. Before she can talk to the jet. Lamb chop, I just pulled up in some fools.